As more and more Mainers start heading outside to enjoy the summer months, it is important to be aware of ticks. Because we had such a mild winter, tick season may be getting an early start. Mark Chalette has the details.
From a scientific perspective, they're very interesting for sure.
As a highly trained entomologist, Nate Walton may find some things interesting about ticks that are wasted on the rest of us.
Yeah, they're fascinating creatures. Uh, their survival skills are kind of amazing.
But their ability to survive may not have been put to the test this past winter.
The biggest thing that might reduce our tick populations over the winter would be very cold periods when there's no snow cover to protect them. And we didn't really see those conditions very much this year.
Which means we may already be experiencing an uptick in ticks.
It's definitely tick season. We've seen a spike in tick cases already in the emergency room.
Typical tick season starts in April, but this year with our mild winter, it may have had a head start, and the numbers out in the woods may be higher than usual. Can these pose a risk to us?
Definitely. Ticks are only second to mosquitoes in terms of transmission of disease.
The primary concern is the well-known Lyme disease, which is found all around the state, but it's not the only concern.
They transmit a lot of different types of diseases.
They transmit not by being on you, but in you.
And it's less than 24 hours. You're typically in the clear. But if that tick is engorged, which means it's spongy or squishy, it's best to seek medical advice.
Tick-borne illnesses can be as sneaky as the ticks themselves.
The way they present, sometimes next day or next week, but sometimes it's all the way nearly 2 months later.
Which means it's really important to avoid the risk. Do a thorough tick check on yourself, your kids, and your pets. If you find one,
perpendicular to the skin with tweezers, pulling up at the base of the skin and pulling directly upwards from the skin. And how do you know you got the complete tick? Is you're going to see a head and a body.
If you know it hasn't been in you very long, you're probably in the clear, but it's still advised to keep an eye on it.
It is very reasonable for you to see a medical care provider if you develop any sort of rash after removing a tick.
That was Mark Chalette reporting. Again, if you find a tick that is embedded in your skin, it doesn't necessarily mean a trip to the emergency room. You can call your primary care doctor to find out what they recommend.